Ladies and gentlemen, welcome to Blood Health Matters. This is a podcast where I have deep conversations with doctors, which is going to help you gather more knowledge about your blood health, how exactly you can make changes to your day-to-day to achieve a better, a healthier lifestyle, and most importantly, gathering more knowledge and awareness about things that all of us need to know about. Today, we're going to be sitting down with Dr. Sharat Damodar, who's had more than 25 years of experience in this particular field. So just sit back, relax, and listen to every single word that this genius has to say. Welcome back, sir. In the previous episode, I heard you mention blood cancer. You mentioned how our movies, the entire Bollywood has actually used it as a wonderful weapon to say that, if you have blood cancer, you're going to die. That's something we've grown up watching as well. But in this episode, I'd like the audience to know more about blood cancer, what people can know about, gather more knowledge about, because I personally feel that awareness about such hard topics is very important, because only then you're prepared for the best and the worst possible outcomes. So, for our listeners, how is blood cancer different from the other type of cancers?
So it's good that you brought this up. In today's world, where earlier we used to only discuss about, say, heart disease or diabetes or, infections, people are more and more aware about cancer. Everybody in our families, we would certainly know somebody who's had a cancer. In your friend circle, you'll know somebody who has cancer.
Yep.
Data tells us that over their lifetime, 1 in 10 persons will get a cancer out of every 10. Okay? So that's the reality we are facing. Now, among the cancers, the solid tumors are obviously the ones which are more common. Okay? So head and neck cancers, because of, the pan chewing, gutka, tobacco usage is common in the northeast part.
It's solid tumors.
Yeah. So they are solid organs.
Right.
Okay. So like breast cancer, ovarian cancer, lung cancer, they are all solid tumors, or they're called solid malignancies. And typically the blood cancers are called liquid malignancies, because that blood is a liquid which is flowing all over the body. So unlike solid tumors where we say stage 1, 2, 3, 4, because it moves from 1 to various stages, in blood cancer, if it is there, it's there in your entire body. So it's all or none. So there's no staging there.
Oh, okay. So like if we're talking about solid tumors, it's affecting a particular...
It can be one area. So in the lung, it's at one part.
Right.
Sometimes it spreads to the liver, spreads to the bone. Obviously, early stage has a higher curative potential.
Right.
You can operate, give radiation, take it out, give some chemotherapy, you cure.
Right.
But if you have stage 4 cancer in a solid tumor, obviously the outcomes are bad.
Right.
But blood, unfortunately, because it's all over your body, even one cell remains, it will come back, which makes it more difficult to treat. Which means you have to kill every single cancer cell. Okay, the blood is produced from the bone marrow,
Right.
which is where it's produced, and then it's spent into the blood.
Right.
So, which is why chemotherapy is the primary armamentarium which we use to treat all the cancers.
Right.
So, how did they discover this? During World War II, they used mustard gas. Okay. And then they found that people exposed to mustard gas, they started dropping their WBC counts. Then somebody thought and said, in blood cancer, the WBC count is going up. So, why don't I give this and bring it down? So, that's how the first chemotherapy was invented for blood cancer.
Wow.
Okay. So chemotherapy is carpet bombing. Okay, bombing. Okay, I have to tell you that. I give some drug, it just goes and hammers everything. The good and the bad get killed. And then the good has to come back. Which is why a lot of side effects, typically a lot of problems, mucositis, hair fall, skin changes. Nobody likes chemotherapy.
Yeah.
For the last 20 years, chemotherapy was only the standard of care for most of the blood cancers. But in today's world, now there are targeted treatments. Okay. So you have a problem. You can pick what is the mutation or the reason for it and use a drug which only goes and selectively kills off the cancer cell. And the step further is something called immunotherapy. Where you take your own cells, tweak it, so that you change the receptor so that fellow will go back and recognize the cancer cell and kill him off. So we're moving from carpet bombing to sniper shooting.
Wow.
Okay, so now you've got a targeted cell kill.
Wow.
So you will not hit the other fellows who are good. So that's the best way to treat. So what are the developments which have happened in the area of cancer? Wow. People are able to identify and say this cancer fellow then is expressing some antigen which the normal fellow is not expressing.
Yep.
So let me find something which will be the antidote to go and hit only that fellow and not the good fellow.
Wow.
So that's how things have progressed. So this is some of the newer things which were available earlier only in the US, but now also in our country.
Yeah.
And that's one of the things which is good for the treatment, which is why we're able to say that we can actually cure now.
Wow.
If you can kill off every single cell, then you can cure.
Wow.
So there's another way to cure it. Now, because the blood is all produced from the bone marrow, suppose you give some treatment and kill off as many cells, but there's still some cells remaining in the bone marrow.
Right.
What you can then do is something called a bone marrow transplant.
Oh,
Okay, take somebody else's blood, your brother, sister, sibling, or sometimes even your parents, and put that into this person after going and hammering his entire bone marrow to destroy it. And these cells will then go and multiply in that person. It's called a bone marrow transplant.
wow.
Where we completely change somebody's blood, including his blood group. So I had patients coming and telling me, now my group has changed. How did you manage to do this?
Wow.
Okay, so this is when you've taken some brother, sister cells and given it.
Yeah.
And the blood being produced in that person is that person's original blood. Okay, so the disease is gone. So that's why we're able to cure. But even with that, we are not at 100% cure rates. Somewhere in this 70-80% cure rate, still 20%, which is not that easy to clear off. But these are all the advances in the treatment of blood cancer.
And that's so good to know, because over the time people, they've had a very big notion in their heads that, if you've got cancer, then that is it.
Yeah.
But that is why, when we were beginning this episode, I mentioned that awareness is very important. Knowledge is very important. The more you know about what you or the people around you are going through, the more you know about the treatments and the solution for, the more hope you feel. I had this friend of mine whose father was a cancer patient. And I still remember he told this one thing to me and I felt in my heart when he said it. He said, it's real. Do not ignore it.
Yeah. It's a reality. That's why I told you that's the next big, problem which we will face as we live longer.
Yeah.
Our longevity is getting better and better. We think we should live for 70, 75 years at least. So clearly you're a higher risk of developing something as you age.
Absolutely.
Plus, so I'm sure, like I told you, everybody would know somebody.
Yeah.
So slowly the stigma attached with that is also coming down. Earlier days, I couldn't even give a diagnosis or tell people, use the word. I used to say, he has a blood problem and I'm treating it. I could not use the word blood cancer.
Yeah.
Because people just started looking at them different.
I'm sure.
One is you just, feel sympathy for the fellow instead of trying to give him, boost him and, saying that, oh God, now you're kind of end of the road for you.
Yeah.
That kind of thing, So it was working more negative for patient.
I'm sure.
So, which is really not fair for that patient. He's trying his best to fight something. And then you have 10 people coming and telling you that, I empathize and blah, 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 whatever. Not fair. So now when you know that your family or your friend can have it, and you should be supporting that fellow. And it's not that just because somebody else has got it, you can't get it. Down the line, you may be in the same boat. Yep. Which is why we need to be aware and thereby cut it away so that people will come out with this earlier. So, when we go to some of our meetings and talk about, diagnosis, the Western world is always very quick to say we are all, early diagnosis people. In India, it's all late diagnosis. People will not come. So you'll have somebody with such a big lump here. I remember one lady who has lived like that for a few years by, carefully covering the sari in such a way that you don't see it.
Why do you?
Because it's a stigma that if she shows it to somebody, people will say, this is definitely cancer with such a big lump. And they will look at her differently. And thereby she didn't even want to bring it to the attention of somebody till it reaches a point where either pain or, it becomes so bad that you come in as an emergency.
But that's such a bad mindset to have because you're only harming yourself. You own around.
But then people are not aware, And then if somebody has not even disclosed it to her family members, I can't jump on the family members either.
Listen.
So people want to subdue some of the problems and not come out, thinking that it will show me in a negative sense that I have a problem. So rather than saying that, see, I have a problem and I'm proud that I picked it up early and I've corrected it.
Yeah.
So I think that's the mindset which should come. That don't be fearful of finding a problem because finding it early is better than finding it late. We don't want you to have a problem for sure. That's the first intent. That's what I tell all my patients. My first thing when I do something is, I don't want to find a problem. I'll be very happy if I get everything normal. But if you have a problem, then I want to pick it up early.
Wonderful.
And not sit on it. That's all.
Wonderful. How long have you been in this industry, sir?
Oh, I'm practicing for about 25 years. My God.
That's almost as close to my age. You've been practicing for as long as my age. But, while you were answering this question, I realized that you've seen such a beautiful transition of this care.
Yes.
Of care, of course. You've seen that transition not just in terms of the treatments that are now available, but also in terms of the mindset that people used to have from what it was to what it is now.
Absolutely, absolutely.
To hear you talk about it all, to hear from someone who's as experienced as you are, it's such a hopeful experience. it fills the mind with so much more hope and positivity about something as scary, I would say, as this. So thank you. This is not just a sense of gratitude from the people who are watching, but also from my own self, because this is something that's very personal to me. As in, and I told you that the father of a friend of mine who suffered from cancer, and he battled through it. Very courageous fellow. So it feels very wonderful when you say all of this to the entire audience for them to know about it more. Thank you very much about it.
Thank you.
I feel that's the perfect point to end this episode as well. Thank you, sir. And thanks to you for listening to another episode of Blood Health Matters. We'll see you very soon. And until then, take care, stay healthy.